It is usually very safe to breastfeed during pregnancy. Your body will continue to produce milk for your older child, and at the same time, your unborn fetus will be getting all the nutrients that it needs from the body. So just make sure that you eat well and you eat often. But what you need to remember is that every time you breastfeed, your brain releases what we call oxytocins, which causes some mild contractions, which you may feel as cramping. So, the big question now is, will it cause preterm labor and possible miscarriages? The answer is no. Very mild lang naman po yung natitrigger na contractions, so you don't have to worry. So, are there any side effects to breastfeeding during pregnancy? Now, some moms may actually experience sore nipples or yung feeling of being fatigued all the time, or they may feel nauseous because of the letdown reflex. And there might be a slight change in the consistency and quantity of the milk. So when is the best time to stop breastfeeding during pregnancy? Now you will notice that around 5 months, your breast will start producing colostrum. So there will be a slight change in the consistency, quality, and even the amount of breast milk produced. So your toddler might not like the taste of colostrum or might find it na mas konti ang milk na nakukuha niya na. So pwedeng mag-wean off siya on his own. Now let's talk about the proper positioning. Now supporting their neck, shoulders, and back will allow your baby to tilt their head and swallow easily. Remember, the most successful breastfeeding will be baby-led. So, bring your baby close to your breast and allow him to latch on his own. Do not lean towards your baby, bringing your breast close to his mouth, because this may actually lead to poor attachment. And here are the 4 signs of good attachment. Here are the 5 breastfeeding positions that we recommend. However, if there is a position that you're doing now that you haven't really heard of, as long as you and your baby are comfortable, then you can continue with that position. For normal delivery patients, you can actually try all the 5 positions. However, for cesarean patients, the football hold and the sideline position will be the most comfortable for you. Breast milk is the best food for babies in the first 1 to 2 years of life. It helps them grow healthy and strong and protects them from infections and illnesses. Breast milk has hormones and the right amount of proteins, sugar, fats, and vitamins to help your baby grow and develop. Milk letdown usually happens 2 to 3 days after delivery. However, there will be moms who will be producing breast milk even during pregnancy. And the supply will always depend on the demand, so continue breastfeeding.